Welcome to Medicine with Ala. Before we start, please don't forget to like, share, and subscribe. Our topic today is definition and different types of bone fractures. Let's start with the definition. A fracture is a broken bone, the same as a crack or a break. A bone may be completely fractured or partially fractured in a number of ways: crosswise, lengthwise, or in multiple pieces. Fractures commonly happen because of car accidents, falls, or sport injuries. Other causes are low bone density and osteoporosis, which cause weakening of the bones. Overuse can cause stress fractures, which are very small cracks in the bone. Now let's move on and talk about types of fracture. First, we have closed fracture, also called simple fracture. In this type of fracture, the bone is broken, however, the skin remains intact. Second, we have open, also called compound fracture. In this type of fracture, the bone is broken and the skin may be pierced by the bone or by a blow that breaks the skin at the time of the fracture. In this type of fracture, the person will be at a high risk of infection, and this is what we have seen in Ibrahim's case. Third, we have complex fracture. A fracture is called complex fracture when the bone breaks into pieces and when the soft tissue surrounding the bone is severely damaged, or when the patient has other illnesses or injuries that complicate treatment and healing. Fourth, we have displaced fracture. In displaced fracture, the pieces of the bone have moved far from each other and a gap is created between them and they are out of their usual alignment. Fifthly, we have non-displaced fracture. From its name, the bones are broken, however, they are still in their usual anatomical alignment. Then we have green stick fracture. This is an incomplete fracture where a portion of the bone is broken and that causes the other side to bend. And this is commonly seen in children. And this is an X-ray image of a 10-year-old boy that has a green stick fracture in his radius. Then we have spiral fracture. In spiral fracture, the break spirals around the bone, and this is common in a twisting injury. And last but not least, we have transverse fracture. A transverse fracture, the fracture has a horizontal fractured line. And lastly, we have comminuted fracture. In this type of fracture, the bone breaks to 3 or more pieces. Now it is X-ray time. Is there a difference between adults and children X-ray image? Children's bone have areas of new bone growth called growth plates at both ends of their bone. They add length and width to the bone. They can be seen on an X-ray image because they are softer and contain less minerals, making them appear darker on an X-ray image than the rest of the bone. Here we can see an X-ray image of leg from a frontal view of both adult and a child, and we could clearly see the growth plates in a child bones as indicated in the pink arrows. However, in adult person, we don't see the growth plates.